What are the symptoms of coronavirus? The most common symptoms of COVID-19 are fever, dry cough, and shortness of breath. These symptoms may not be sudden, rather begin gradually. How does COVID-19 spread? The disease can spread from person to person through small droplets from the nose or mouth of the infected person, which are spread when he coughs or sneezes. You can also catch it by touching the objects and surfaces around an infected person and then touching your eyes, nose, or mouth. You can also catch COVID-19 if you breathe in droplets when a COVID-19 infected coughs out or exhales droplets. Are antibiotics effective in preventing or treating COVID-19? No, antibiotics do not work against viruses. They only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics do not work. How to protect and prevent from COVID-19? Regularly wash your hands with soap and water for about 20 seconds. Thoroughly clean your hands with an alcohol-based sanitizer. Maintain at least 1 meter, almost 3 feet of distance from anyone who's coughing or sneezing. Avoid touching your eyes, nose and mouth. Covering your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Then dispose of the used tissue immediately. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. Precaution, not panic.